Um, would you like to introduce yourself?
Sue.
And
Wayne.
and Sue, let's begin with you. What initially brought you in to see Dr. Lawler?
I was cold all the time many years ago, and I thought it was thyroid maybe, because I was sitting there with heavy robes and always cold. And by doing the blood test, Dr. Lala discovered was what was wrong, basically a vitamin B deficiency and beginning of anemia. So he put me on a fairly high dosage of supplements, and then in 6 months on a maintenance.
Okay, and you're feeling much better?
Yes, yes.
So and since then, you've also had a number of like, you had 2 auto accidents?
I had one main auto accident, and then I had 2 rear end people running, whiplash, hitting me in the back.
Okay, so they rear-ended you.
Yeah.
What were the results of the first one?
The first one was a broken collarbone. And the other 2 with the whiplash, I have a tremor, and that probably made that worse. And that's been taken care of by calcium supplements and adjustments.
Okay. And so your care has been mainly consisting of?
Yeah, supplements, adjustments, and every year a blood test to see if, if everything's okay, and to readjust the supplements based on that.
And you're feeling better?
Yes.
Wonderful. And Wayne, you started coming in to see, first you started to see Dr. Lala.
That's correct.
And what prompted you to come in for that?
I had major problems in walking and lots of pain, extreme pain trying to, when I would try to get up from a chair it hurt, and I couldn't walk very far. That's when I believe that's the circumstance that Dr. Lala suggested I see you for your specialties in training. And after various few times with you, and that's been about a year ago now, I haven't had a recurrence. Whatever was wrong, to use a layman's term, is fixed, and so that's no longer a problem. And I was almost to the point I felt I was going to end up in a wheelchair.
Tell me, there was some stuff that you were very concerned about being able to go to the fair. Could you tell me about that?
Well, that was a different problem with my right foot. I'd had a bad sprain there a few years ago. I don't know if that's the reason why this is a recurring problem, but a ligament or a muscle or something in the right angle. I really couldn't walk with about a block. And when you're in that situation, you realize certain things you aren't able to do, and one of the things was being able to go to the fair and walk around all day long, well, probably 3-4 miles by the time you spend 6-8 hours there. And so I skipped the fair for the 2 preceding years, 9 and 10, and by the improvements with coming to visit you for the adjustments and muscle work, I went this last year for the first time in 3 years, which was I didn't realize I missed the fair until I didn't go for 2 years. And so in being able to walk, those are the little things that make life enjoyable.
Wonderful, thank you. What would each of you say to somebody who's thinking about coming to this clinic?
Well, I think coming to the clinic, having maybe the blood test, keeps you overall health and body in shape and might possibly prevent disease, or I guess just to keep your general health.
And that's very important coming from you, Sue, because you're very health conscious. Very health
Yeah.
conscious. You've really tried to take care of yourself over the years. So I appreciate that, the stress that you put on that test for us. Wayne, how about yourself?
Well, that's pretty much the reason that I get it like every 6 months, the blood test and readjustment of the supplements. And I don't really know exactly where to get the equivalent in the regular medical setup, because if when you go in for something, they only want to test you just one or two things. I mean, trying to get information, for me, trying to get information out of the standard medical doctors, it proved to be very frustrating and essentially impossible. One physician I asked about glucosamine and chondroitin, and he looked at me and said, "I have no idea what it is." And I asked another one, MD, about how do you control diabetes or glucose, the blood sugar. That I'd heard that cinnamon was could be in it. This person looked at me and said, "I have no idea what you're talking about." So I realized I was in the situation of asking questions of people who apparently don't get training in med school in areas that I think are important. And so subsequently, the blood tests give this kind of information that I can't get anyplace else. I don't know where to get it other than you folks. And that definitely is what impinges on health.
Well, thank you very much. Do we have both of your permission to share this with doctors, patients, students, and the general public everywhere?
Yes.
Yes.
Thank you. Any restrictions on it?
No.
No.
This is our opinions and this is our experience in life. So,
Thank you very much.
yes, sir.
Appreciate it.